Okay, so next I'll go over the vestibular oculomotor screen, which is to assess a patient's function, specifically eye and inner ear function after having a concussion. So first we'll get a baseline of your symptoms. Usually we'll just ask about headache, dizziness, nausea, or fogginess, but for certain patients we can also include other symptoms if you're having any. And so we'll first get a baseline score for each of those, and then we'll assess how your eyes are moving, tracking an object, how they move back and forth between objects, side to side, up and down. And then in between each of these tests, we'll be asking about symptoms. Did your symptoms increase? Are they decreasing? And then we'll also do tests of how your inner ears are functioning. So with head movement, keeping your eyes on a fixed target, does that increase your symptoms? Also moving your eyes and your head together side to side and seeing if that increases your symptoms. So we can determine if a person is likely to have had a concussion based on how they perform on this test. And then we can also repeat this test later on to see, okay, now that we've done treatment, how are your symptoms with each of these tests and each of these eye and inner ear functions?